Hi. I did this interview with my fellow co-worker at the vet clinic that I'm working at. She actually graduated from Stotzenberger a few years ago, and we've been working together now for a few months. I'm a vet assistant there, and she's a vet tech, so she has a couple of years of experience on me. So I decided that I wanted to interview her to see if I could pick her brain a little bit. I started with just talking about kind of what the daily tasks and things that she's supposed to do every day, and we kind of went over how running appointments is one of the big ones as a tech. We usually go in before the vets do to talk to clients, kind of get a brief history and TPR to kind of gauge exactly where the patient is before the vet comes in so they can do a little research if they have to. Um, so that's a big part of it. Also, setting up for surgery. Our surgery days are actually on Tuesdays and Thursdays, so when we come in there at 8 in the morning, we like to set up for surgeries and prep our patients, and that would include things like running their blood work to make sure they're healthy enough for anesthesia, and prepping catheters to make sure that we have easy access to their veins in case something goes wrong during surgery, and also being able to pre-med the animals before surgery. So that's a big part of it too. Running tests such as blood work for things routine, or checking levels that they have in their body, say if they're on a drug like phenobarbital, or if they're on thyroid medication, we have to run thyroid tests on them to make sure that they're at the right level of dosage to keep their thyroid within normal limits. Also running things like urinalysis. We actually do that a lot in our clinic. We see a lot of patients with possible UTIs, so we're always running urinalyses, and we look at them under the microscope to see if there's any bacteria or white blood cells, red blood cells, crystals, what type they are. And we actually do a lot of lepto stuff too. So we run a lot of lepto work, so that just kind of makes us gathering. We gather urine and a drop of blood, and we send it out. So that's also a big part of our job, setting up samples for anything and everything. A lot, and then also with running appointments comes the stuff you have to do in there, like drawing up vaccines, something simple like that, or taking a swab of a dog's ears if they have an ear infection. And then I asked her what her typical day is like and what the hours are usually like, and she said that from where she's worked, her typical days are usually between 8 and 12-hour shifts, depending if you're emergency or a small animal clinic like where we're at. Where we are, our normal shift is usually from 8 in the morning till 7 at night. Um, and then Wednesdays we're only there till 2, and Saturdays are another short day there till 2. So it's really not that bad. And a routine day is just running appointments for vets. And Tuesdays and Thursdays, like I said before, are surgery days, so those are the days that we do surgery stuff. And then she talked about the most important class that she took at Stotzenberger, and she thought that the small animal disease was really important, just because we see a lot of small animals in our clinic. So learning about the most common things that they can have really helps. We see a lot of patients that have diabetes or a thyroid issue, so knowing things about that. A lot of kidney patients come in too, so knowing some of the signs of maybe kidney failure or liver failure or even heart failure is really well. And so I'm super excited to take that class because I really want to be able to walk into a room and be like, oh, I have a pretty good idea of what that is because I took that class. Um, and she said that she hopes to see herself working full time in a small animal clinic in the future, and she said she also wanted to do some work in nonprofit, working at a shelter too, just volunteering her time and helping those who need our help the most. I asked her if she had um, any advice to help me achieve more goals in my career, and she said the biggest part was taking advantage of the CE hours. I know with our clinic, they go out and find CE hours for us to take, and will even, help pay for us to go. So she said really take advantage of that. If they offer you the hours, go take it, because it's always on a new topic that might help you learn how to treat something differently than you did before. I know at our last CE hours we learned a lot about probiotics that we hadn't really talked about before, and it's really good for a multitude of options. And we actually had a CE class that talked about cats and heartworm, and how important that is, and how dangerous it is for cats, and how a lot of the owners just don't understand how important it is. So take advantage of those CE hours. And then she also said study really hard when you're at school. The more you can remember, the better. And then I asked her if she thought that this was a growing field for us, and she definitely thought that it was, just because it wasn't too long ago that to be a vet tech it didn't require a license. So a lot of vet clinics lost their techs because they were actually just assistants, and now that they require that license, they had to go back to school. So that's good. More opportunities for us that are in school going to get our license now. I asked her what she liked about her job the most, and obviously the answer was, helping the animals. She also said that she has a deep interest in the medical field in general too, so learning how the body works at like a chemical level and a hormone level was really interesting to her too. She always likes to run blood work to see exactly what's going on the inside of the animal, not just how cute they are on the outside. She said the most stressful part of her job was working with euthanasias. She said it's sad and it's hard, especially when the owners are very upset, and you can see that the animal is clearly very sick, and it's stressful to be in that kind of situation. But it's always for the best, because the animal's usually suffering, so it's good to take away their pain. So I learned a lot from her from this interview, and I'm really excited to continue working with her and to see what she can teach me. And I can't wait to be a tech myself, so hopefully someday somebody can interview me and I can give them answers that are helpful.